Good morning. I'm Andrew Schiff, CEO at the Rhode Island Community Food Bank. Thank you for joining us this morning for the release of the Food Bank's 2020 status report on hunger in Rhode Island. Very happy to be joined this morning by Senator Jack Reed. After I present the major findings from the report, you'll be hearing from Senator Reed and from Rilwan Fairstand Jr., the Executive Director of CAP, the Community Action Partnership of Providence County. CAP is a member agency of the Food Bank, and Rilwan is a member of our Board of Directors. We'll also have time for questions from the press. Anyone who has questions while we're presenting, you can enter those questions in the Q&A box at the bottom of the screen, or you can wait until we've all presented and at the end ask your questions live. The status report addresses the devastating impact of COVID-19. In Rhode Island, 48,000 people have tested positive for COVID-19, and close to 1,300 people have lost their lives. And right now, the rate of infection is increasing. This health emergency has created an economic crisis. We have so many people who have permanently lost their jobs. And as a result, thousands of families are struggling financially and are in dire need of food. We had a study done this past summer by researchers at Brown University in cooperation with Blue Cross and Blue Shield of Rhode Island. And they surveyed households across the state. One of their questions was whether households were running out of food, and if they ran out of food, were they able to buy more? It's shocking, but 1 in 4 households lack adequate food. 1 in 4. The rate of food insecurity was even higher, 1 in 3 for Black and Latinx households. They're also the ones suffering the most from coronavirus disease. Black Rhode Islanders and Latinx Rhode Islanders are overrepresented among COVID cases and hospitalizations. COVID-19 has tragically exacerbated long-standing health and economic disparities in our community. Every day at the food bank, we see the plight of people who have been harmed by this pandemic recession. Before March, on average, we were serving about 53,000 people every month through our statewide network of member agencies. 53,000, we thought that was too many. Since March, we've been serving 68,000 people every month. In the status report, we document the full-out emergency response of the state in the spring that really helped to prevent widespread hunger. The Rhode Island Emergency Management Agency, in cooperation with the Food Bank and FEMA, distributed hundreds of thousands of meals. And at the same time, through the hard work of staff at the Rhode Island Department of Human Services, SNAP households enrolled in SNAP, saw an increase in their benefits. SNAP is the Supplemental Nutrition Assistance Program, formerly known as the Food Stamp Program. The state also acted right away to implement a new federal program called Pandemic EBT. This program targets children from low-income families who normally receive free school lunch and school breakfast. And the pandemic EBT benefits are strictly for the purchase of food, like SNAP benefits, and it goes to their parents. So these federal nutrition programs, this government food assistance made a really big difference, along with other government assistance like the extra $600 a week in unemployment compensation for recently laid off workers. The problem now is that much of this government assistance is ending. It's time limited. When pandemic EBT benefits ended in June, we saw a spike in the number of households in Rhode Island without adequate food. When the extra unemployment compensation benefits stopped, we saw more people in line at food pantries. We are nowhere near the end of this crisis. I mean, there is, thankfully, now a vaccine for COVID-19 on the horizon. But the economic recovery is going to be long and slow. And that's why we're calling on Congress to enact another COVID-19 relief bill to increase unemployment benefits and increase SNAP benefit levels. We should learn from experience and implement pandemic EBT this summer when kids are out of school again for summer vacation. And in Rhode Island, we should do everything possible to enroll every eligible family in SNAP and every eligible child in free school meals. And the food bank will need the continued support of the public and the General Assembly if we're going to have enough food to ensure that no one in Rhode Island goes hungry. We are lucky to have a congressional delegation led by Senator Reid that recognizes the urgent need at this moment. And we're hoping that when President-elect Biden takes office in January, our congressional delegation will be able to do even more to protect Rhode Islanders from bankruptcies and evictions and from hunger. And now it's my great pleasure to welcome Senator Reid, who's joining us now. Welcome, Senator.
Well, thank you very much, Andrew, for that very kind introduction and for your great leadership. I also want to commend Rowan and his staff and volunteers for the tremendous work that they do. And thank you to all your volunteers, your advocates, your employees. They do incredible work for the people of Rhode Island. Now, we all know Thanksgiving will be different this year. I know how hard it is not to get together with our families, but COVID-19 isn't taking a holiday break, so we can't either. Still, we have much to be thankful for and an opportunity to start some new traditions. And by doing our part to protect others now, we can help ensure future Thanksgivings can be celebrated around the crowded table like we used to do. At the federal level, I'm working to ensure Americans invest in proven methods for combating the virus, things like testing, contact tracing, vaccines, and public health infrastructure. We need a national strategy and federal resources to do this. That has been completely lacking from the current administration and the Republican majority in the Senate. As we work to address the ongoing pandemic, we also must provide additional nutritional support for all our people. It is the right thing to do, and it is the just common sense thing to do. Many of the people served by food assistance programs have other conditions that put them at greater risk for COVID-19. The 2020 status report on hunger in Rhode Island is a stark reminder of the impact that the pandemic has had on many families and their ability to access healthy foods. There are simply too many hungry families in Rhode Island and across the country. National newscasts are filled with images of people lined up for hours to get food assistance. And food insecurity in Rhode Island is at a 20-year high. So Congress must do more to help. We've taken some steps, like passing the Families First Coronavirus Response Act. This allowed Rhode Island to increase benefits to SNAP households to the maximum allowed level and created the Pandemic EBT program, which you've talked about, Andy. And that has provided that program over $34 million in additional benefits for low-income parents so far. But it is clear that more is needed. People need a lifeline. But inaction from the Trump administration and congressional Republican leaders is pushing more Americans into poverty and could tip the economy into a deeper, longer economic recession. I support a 15% increase in SNAP benefits in the next relief package. That would amount to about $25 more per person per month, or just under $100 per month in food assistance for a family of four. Not enough by itself, but an important part of a comprehensive response. SNAP benefits are also one of the fastest, most effective forms of economic stimulus because they get money into the local economy quickly. The HEROES Act, which the House passed in May, included this increase, but Republicans have blocked efforts to include this SNAP increase in the Senate for many, many months. Now, President-elect Biden has urged us to pass a comprehensive bill that actually meets the needs of the American people. This should be, and quite frankly, is simple. During a crisis, you feed people. It is both the right moral decision, the right economic decision, and the right policy decision. And there's indications now that the Republicans are beginning to talk to Democratic leaders to see if we could get something done before the transition to the Biden administration. But it's deeply discouraging to have witnessed this gridlock over many months. Unfortunately, as I said, Senator McConnell seems to be at least engaging in conversations. As a result, I'm hopeful we can do more to provide relief across a range of issues, nutrition included. Again, I'd like to thank the Rhode Island Community Food Bank and all of you for your outstanding work. This is a time of year to count our many blessings and think about what we can do to help others. Wherever we are this Thanksgiving, we want everyone to have full plates and full hearts and do their part to keep each other safe. We are one big Rhode Island family and an even bigger American family. Families don't always agree, but we stick together. Thank you again, and let me turn it back to Andrew.
Thank you so much, Senator. Thank you for being here this morning, and thank you so much for your leadership. You know, the food bank partners with community-based organizations across Rhode Island to provide food assistance, and COVID-19 has been very challenging for our member agencies, not only because of the high demand for food assistance, but also because they've had to adjust their operations to keep everybody safe, including their staff and volunteers and the people coming for food assistance. CAP, the Community Action Partnership of Providence County, is one of our largest member agencies, and they played a major role in responding to COVID-19. But now it's my pleasure to introduce Rilwan Feshdan, the Executive Director of CAP.
Good morning, everyone. I want to first start by thanking our senior senator for his tireless work he's doing in Congress to support everyday Rhode Islanders around food insecurity, but also being a champion around issues like ruralization and lessening energy burdens, which we know are common sense measures that put more money back into the pockets of Rhode Islanders and allow them to purchase more food. I also want to start this morning by thanking Andrew and his amazing staff at the food bank and the rest of our fellow board members on the board of directors and the incredible member organizations of which Community Action Partnership of Providence County is one. As the report on hunger shows, our network of food closets and pantries are serving unprecedented levels of needs. Rhode Islanders are struggling, and it's evident. I want to share just very briefly with you the Providence story, but I want you to understand that this story is playing out across communities across our state, and it's just magnified because Providence has the largest poverty index in the state and also has the largest rates of infection for COVID and hospitalizations in our state. But this is a story that every one of our 39 cities and towns are sharing from point to point in our state. On a typical month prior to COVID, our pantry in Providence would serve over 600 families from just one zip code in the city of Providence, serving low-income communities that are hardly hit and really vulnerable to food insecurity. During the months of August, July, August, and September of this year, we saw over 1,000 residents a month from that one zip code alone coming to our pantries seeking services. Many of them had never saw our services and were unique to coming into the pantry. And in addition to that, we saw several hundreds of Providence residents coming in from areas outside of that zip code also needing support during that time. Prior to COVID, we operated a 3-day-a-week senior meals program, hot meals, congregate meals program for our seniors. When we went into phase 1 early in the pandemic, we weren't able to service our seniors and bring them into our buildings and our spaces safely. So almost overnight, we went into emergency mode and had to pivot to doing an operation where we were serving them 5 days a week lunch, delivering it to their homes, in addition to providing meals to those that were quarantined with COVID. Now, several months later, we're not only continuing to do that work as other agencies that would typically provide these services were maxed out and beyond their ability to serve the homebound community. So we're not only doing lunches 5 days a week, we're also doing dinners. And we're providing meals and services on Fridays to make sure that they have provisions through the weekend so that they're adequately getting at least 2 nutritious meals a day. That story is not unique to just Community Action Partnership of Providence County. I am privileged to serve on a committee for the food bank that works with and looks at what our member agencies are doing. Part of that assessment work that feeds into the larger report that we're talking about today, we recognize that 21 of our 24 largest agencies have also amazingly are doing some level of home delivery work as well to those that need these critical provisions of food. So again, from our in-person work that we do serving thousands of people, we're equally serving hundreds of meals in the homes of Rhode Islanders that can't get to us and need these services as well. We are at a critical juncture in this work as numbers of COVID are rising and we see the needs continuing to grow as we go into the winter months and the colder months. As many of us get ready for the holidays, I'm thinking about those high school and elementary and middle school children that won't be at school this week, that won't have access to the school lunch program or the meals programs. That as they go on break, there will be children that will be hungry this week if they're not at one of our pantries or receiving services this week. If it isn't for the network that the Rhode Island Food Bank provides, so many more Rhode Islanders would be struggling now. And that's what I'm keenly aware of and what I'm thankful for, that we were able to stand up and be part of that critical work that's happening through every one of our towns to be there for Rhode Islanders. Here at CAP, we lead by and work by a mantra, leading with dignity, serving with purpose. And that's what member agencies of the food bank, along with their amazing staff, have done. We've led intentionally, worked long hours. We're not considered first responders, and we know the amazing work that they do, but we are essential workers. We're frontline every day, receiving people in this incredible pandemic. And we're grateful for the support, but we know that so much more needs to be done. I again thank our congressional delegation for being champions of that work, and we implore our elected officials to stand up and stand with us as we do this important work. Every Rhode Island deserves the dignity that we try to bring to the work each and every day here at CAP, and we ask you to continue to join with us in that work. We thank you this morning. We appreciate the amazing report that highlights the incredible work that still needs to go on. Thank you this morning for allowing me to share a few minutes with you.
Thank you, Rowan. Thank you for the extraordinary work that everyone does at CAP. We're ready now to take questions from the press for Senator Reed, for Rowan, or for me. And I'm going to introduce our communications director, Hugh Miner, who will help us take and answer those questions.
Hi, thank you. Thanks for having me. We do have a question for Senator Reed. Just looking toward the future, as we have a new administration, what can we hope for in terms of funding for federal nutrition programs?
Well, I'm optimistic about the Biden administration providing robust funding for these food programs. It's essential. One of the aspects of our food programs is making sure children have adequate nutrition so they can do well in school. So this is not just about nutrition per se. This is about success in school, success in life. And President-elect Biden understands that very, very well. So I'm optimistic. I think, we've seen this pushback, particularly by my Republican colleagues in the Senate. I think that will continue. But I think hopefully we can overcome that, and we can come together and provide the kind of resources we need. As Andrew and Ruan has pointed out, this COVID crisis is not going to abate tomorrow. Even with the vaccine, it's going to be months. And so we have to do a number of things. One is nutrition. That's probably one of the first issues. Second, we have to anticipate people with problems of housing, behind in rent, eviction. We have to anticipate people even losing their homes through mortgage foreclosure. All of that compounds the nutrition situation because they're in this dilemma of what do I pay first, my rent, or buy food, or transit money to get to my job, or what do I do? And we have to respond to that. And I'm confident the Biden administration will do that enthusiastically and passionately.
Rowan, a question for you. What can people do to support CAP? What is it that you need the most from people?
We have been so amazingly blessed by how Rhode Islanders have stood up. When we talk about dignity, it's returning dignity to those that need it the most. For us, we always are in need of resources. I think as the food bank has looked at generous donors, we're always looking for donors to continue the work that we have. And we're hoping that we don't see donor fatigue as we go into the year. So as folks have given so generously, we hope that they will continue to do that in the months to come so that we can provide those critically needed services at a critically needed time.
Great. If anyone has questions, feel free to raise your hand. We have a question from Arden from the Warwick Beacon. Andrew and Rowan, can you speak to the demographics of the people using your services? Particularly Rowan, I think that's, who are the people that CAP serves?
So as an agency, we serve 33,000 Providence residents in Providence alone. We were able to send out over the last 3 weeks a COVID-19 survey, which we got over 1,000 responses, and we're still going through that data. It's a cross-section here in the city of Providence, but also some surrounding communities. They're everyday Rhode Islanders, everyday Providence residents in our case, some of which in years past would have been donors, and now they're literally coming in and receiving services because they're unemployed or their unemployment benefits have elapsed. So they are the spectrum from cradle to grave in my public health days before coming into this space, from our most vulnerable seniors to families asking for help with formulary and baby food. So the needs are just really unique, even beyond what we would normally see during a normal year. So they run the gamut of folks that are needing help and needing support.
And Andrew, do you want to talk about the bigger picture statewide? What we're
It's
seeing?
very similar statewide. It's the newly unemployed, folks who may have been hoping that their jobs would have come back by now, and their jobs just aren't coming back, and realizing that they're facing a permanent layoff from their jobs. They're going to have to apply for new work, maybe even in a different field, and those jobs just aren't there yet. So families are really struggling financially. And this time of year means higher utility bills, heating bills that add to the problem.
Okay, and I have a couple of hands raised, so we're going to try this, inviting someone in to ask their question. We have David Dadakian from Eat Drink Rhode Island. Hello, David.
Hello, do you hear me?
Yes.
All right, great. I'm glad to be the guinea pig for you trying this. I'm glad it works. Thank you all very much for taking my question and for the report this morning. It's very sobering, as usual, but thank you for your time. Senator Reid, I thank you very much and applaud you for your work in aiding Rhode Islanders during the pandemic. I wanted to speak specifically to further stimulus and the restaurant sector. It's on the brink of collapse. Restaurants we all know and love, and they help the food bank very much so during fundraisers. You've been to some of our events there. The Restaurants Act is a great stimulus package. It's had broad bipartisan support. It was passed by the House in the HEROES Act too, and now it's stalled with stimulus in the Senate, which of course I'm sure frustrates you as well.
Yes.
I don't know. Hopefully everything goes well in Georgia, and after the inauguration. But I don't know that these restaurants, many of them, are even going to be able to make it till February. And then I think stimulus in general, that includes a lot of people who can't even make it till February right now. I know it's not, it's a bit out of your hands, but what can you do? What can be done to get stimulus out there and hopefully this Restaurants Act before it's too late? This may be our last hope.
Well, as I indicated in my comments, an encouraging sign is that for the first time since last May, after the HEROES Act passed, that Senator McConnell is sitting down and talking to Leader Schumer and Speaker Pelosi and Kevin McCarthy from the House. And so there is, I think, an attempt to try to get a COVID package together. And from my point of view, it has to include the Restaurant Act because, as you pointed out, David, the survival of these typically small family-owned enterprises is at stake. I hope we can do that. We're pushing very hard. The slim bill that the Republicans brought up to sort of provide some coverage before the election didn't have adequate resources for restaurants. We hope this bill does, and we hope we can get it done before the end of December so that there'll be an opportunity, hopefully, for restaurants to stabilize and make it through a very difficult winter. But we're working on that now.
Thank you. I appreciate that answer. I hope so. Thank you all very much, and happy Thanksgiving to all of you and your families.
Happy Thanksgiving.
And I have a question here from Steve Lampkin from WPRO Radio.
Here we go. Hi. Thank you. Andrew, are there any food banks that have had to close? Are there any areas of the state that are going uncovered?
Back in March and April, we had some temporary closures, but, I'm really proud to say that everybody came back on board and was able to continue to do their work from time to time, just like any organization. They will have staff or volunteers who are testing positive for COVID, and then following the Department of Health guidelines, they'll have to take a temporary pause, quarantine, but then they come back. And every single day we monitor which of our member agencies are open. If one has to close because of a COVID incident, what we've seen is just amazing cooperation from the nearby member agencies that step it up and serve people from that community when they're called on.
Thank you.
Great, thank you, Steve. We have no other questions, and we're right at about 10:30. So, unless someone has a last question to raise. Nope.
Good. Well, I just want to thank you, Hugh. Thank you, Senator Reid. Thank you, Rowan, for being here this morning. This is a time when we know that we have lots of people who may need help. And I just want to end by saying that if you're watching and your family needs food assistance, call 211. That's the United Way. That's their hotline. And you will get a real person who will answer the phone and will be able to direct you to help. So for everyone who's here this morning, Senator Reid, Rowan, wishing you and everybody a safe Thanksgiving and a happy Thanksgiving.
You as well. Thank you.
Thank you very much.
Thanks, everyone.
Bye now.